you need to identify, okay, what you need to do for this assignment is you need to identify a research study, okay, from paper or from article, okay, from the website that conducted in a hospital and involve pediatric disease. So meaning that it should involve children, okay, young babies or very young infant, okay, in the study. So, and this study needs to be involved intervention, doesn't matter, drug, testing on drug or medicine or surgery, behavior or lifestyle changes. Any of these points we do. Okay, so the focus is not on how good is that article. Okay, we just want to use that article to give some background for you to do a consent form. Okay, you need to draft out for me a consent form, but all the information is from the article. You can use the article to help you, okay, to make a consent form. So the objective is you want to integrated ethical principles and rule into the requirements of obtaining informed consents. So we have already gone through a lot of informed consents. Okay, what to be included and what are the important criteria inside the informed consents, right? Everything, and what are the principles. So we have to include everything. Okay, use all of these informations and apply into this assignment. So what do you need to prepare is 2 documents. One is the participants' information sheet. Okay, so ready to be given to the participants. So meaning that you will distribute this information sheet to the participants. Okay, so that they will give you consent and agree to join your research study. So next one, the consent statement. So the consent statement is usually comprised of all the agreement. Okay, something like this, for example, I have read all the information given by doctor. I have fully understand all the information addressed in the information sheet, or the doctor has answered all my questions involved in this research study. Then only include the signature, the sign. Okay, so because this study is involve children, so you need who to sign? Parents, yes. So imagine, so you are giving the consent form to the parents. So you need to address all the concern in the consent form so that they're willing to give you consent to do research study on their children. Right, you need to address all the points. Later we will discuss what are the important points that we need to include. Okay, don't worry. So this is the 2 things. One is the participant information sheet. Usually later we will see what are the information that you need to be included in the consent, then in the sheet, and then the consent statement. So meaning that you have agreed. Okay, I understand, I fully understood everything, and the doctor has given me sufficient time, and he has already addressed all my questions, something like that. Then hereby I confirm my name, give my consent, okay, to perform this surgery, something like that. Okay, so submission. So submit in either Word or PDF file through the e-learn by March 10. Okay, so I think should be okay, right? Since it is a group work. Okay, try to find your housemate to work together in maximum of 5 students per group, and then distribute the work. Okay, distribute the work and make sure you can submit. Okay, so for those who have a reason who require extensions for the deadline, so please let me know if you cannot make it within this deadline. Okay, so automatically the plagiarism will be checked, and then more than 25% is not okay. You need to rephrase. Okay, so if you have more than 25%, you need to rephrase the sentence so that the plagiarism can be reduced. And a reminder note here, so you can refer all the information related to the children. Okay, when you involve any research related to children, you can refer to the International Ethical Guideline on topic on guideline number 70. Okay, 17. So I already upload this international ethical guideline on Monday, right? Our recent lecture. So in the e-learn, you check and then you go to the meat of the document. There is one ethical guideline 17. Okay, research involving children. Okay, so you can understand more information from the guideline. Then only you know what to include, what to be included in the consent form. So you can look for any other good reference as well. Okay, so I believe that from the internet source you can search a lot of template. Okay, template for patients information sheet or templates for consent form. Okay, so you can see how they are doing, and then you can use the informations in your article to apply. Okay, to prepare a consent form. Of course, I will not request for a very professional consent form, unless, but at least you include all the necessary information. Okay, so now we will see what are the important information that you need to be included in your consent, on your participants information sheet and consent form. So before we go to the rubric, any question? No one? Okay, so the content to be included like the purpose of your study. Okay, so of course from the starting you may provide a title, right? A title of your research study. And then the purpose. What is the purpose of this study and how important it has the social value? Okay, which we have learned. And then declarations of the conflicts and of interest. So remember, we have learned you need to include all the conflicts of interest involved. Declare. If you have no conflicts of interest, then you declare no conflicts of interest. All your sponsor, all your collaborator have to be included, all your funding, okay, need to be included. Important thing is risk and benefit assessment. What are the risks? What are the adverse effects on the children? What are all the discomfort? So if you are parents, you read the information. So you need to know all this, right? What are the benefits? Okay, what are the potential benefits? So even no direct benefit to the children, how is it benefit to the society? Larger populations of children. Okay. Next one, essential ethical statement. This is what I have mentioned. The one, I agree, I understand. The doctor has addressed all the important points and give me clear explanation. I have sufficient time to consider. So by here, I'm signing is meaning that I agree to give the consent form. Okay? So you need some statement, just not just signature. You need something right on the top. So confidentiality. So how you going to protect the confidentiality of this research study? Okay? So list of whom to contact. So don't forget, you need to include all your investigator, all your team partner, and then all your funders, everything, and not only provide their name. Okay, don't just give me a list of names, but you need to make sure that the participants able to contact them in terms of emergency or in terms of if they have any enquiries, okay, on the study. And then sentence need to be written in such a manner that these study participants and their understanding. Okay, so this one is important because usually students will give very scientific term. Try to avoid scientific jargon and imagine you are the parents to read the consent. Whether you can understand and then not very long and just try to straight to the point and give very clear information, clear and direct information so that parents can understand, okay, what you are doing. If you are doing so complicated and very long, parents may give up to read, okay, before they want to consider, okay, to join your research study. And then consent form. This one is the statement and endorsement of the consent letter. And then I have also listed, okay, some of the format you can check through, and I will upload this rubric into the e-learn and the title. Okay, the previous slide and then the rubric. So you can check through what you need to do on in terms of the format to reduce some losings of mark, okay, to prevent any losings of the mark. So what else do we need to include in additional to all these points? Okay, you can include any follow-up, right? What the children need to do. Is it just one time or any follow-up? If you need follow-up, depends on the article you choose. Okay, if the article you choose is try to recruit their blood for 3 times, so you need to actually emphasize how many times you need the children to attend in the hospital and provide more details. Okay, and when they will need to come, every 2 weeks or every 3 weeks, every 1 week, or what they need to do, what is their involvement in that study. Okay, just to draw blood every 2 weeks, or they need to give some sample, or they need to do some examination or something like that. Okay, so you can include. What else? Okay, I think that's all. So we will see some example. Okay, so you can prepare your patient's patient's information sheet in different method. Okay, in different way, as long as you can convey the message to the parents. Okay, so this is one example. Usually we will use some question and answer form. Okay, so what is the purpose of this project? Okay, or what happened to me if I take part? Something like that. If you don't want to prepare in question form, you can just put a heading. Okay, the objective of this study. No need a question. Okay, the criteria of selections of participants. Something like that. Not necessarily you need to prepare a question, depends on you. Because sometimes some investigator will prefer using some question answer so that participants can easily understand, okay, on the question. And mostly these questions are the related question that the participants will ask, okay, and then will increase their understanding. So how long? Durations of this survey. Okay, how long is this research study? 1 year? When is the starting time of this research, and what is the ending time? And as I mentioned, how many times you need the children to attend the hospital? Any follow-up or no follow-up, or what they are going to do, involvement? And then am I eligible to take part? So every study, you need an inclusion and exclusion criteria. Not everyone can join without the requirement, right? So for example, this one, they are doing a survey. Okay, this one is I capture from a student sending me for an online survey. Okay, so this is doing some relationship between my employee and employer, voice and job, something like that. This one is online survey, but you have to apply. This one is just give you like one template how to do. You need to apply using research study involve children. Okay, the information from the article. So usually in the article they will mention what are the age they want to recruit. Maybe 1 to 12 years old, or more than they want to recruit students or children more than 5 years old. Okay, they have the criteria. Okay, above 18 years old, or they have any important information, any other. So they must have this symptom, or they have shown infected by COVID 2 times, or any other criteria. Okay, and any exclusion, sometimes they exclude, right? Like for those who are very weak or very sick, they exclude, right? Or some those who are not stable, medical record is not having a stable medical record, and then they have to exclude. Okay, so you can mention what are the inclusion and exclusion criteria. And the next one, do I have to take part? So this one is the important information you need to include in your assignment. Okay, so as I mentioned, you need to clearly let them know the joining of this research is based on voluntary. Okay, no forcing. Do do I have to take part? So your answer is no. Okay, you can join if you are interested, if you are volunteer, but you can also don't agree to join. Okay, you need to mention this one, and giving permission and you will not have any impact on you. So meaning that if you're not joining, so you will not affect any, you will not have any medical service impact on you, and you have to take note that they can withdraw at any time point, right, during the research study. All these information is important, you need to include, okay, inside the consent form. And next one, how will my information or how will my research data being kept confidential? Of course, they want to know, right? If you are distributed to all the public database, so of course they will not allow. So you need to describe a bit. Okay, how are you going to do? Who has the access? Who has the access? We have gone through, right, all this information. Okay, and then are there any risk factor? These are all the potential side effect, adverse effect. Okay, based on the specific interventions in the article. Okay, you found, and then will I be given any compensation? Okay, so these are all the example. These are all the example of question. Of course, they will have a lot more, but I just try to capture a 2 screenshot, okay, for you all as reference. So you can ask any question and address all the concern. So in additional to this, so you can also include maybe some brief intro of your research study, right? Brief intro about all this information and then method, okay? So the procedure, so if you are choosing a surgery, so you can describe a bit the method or the procedure, okay? To increase the confidence of the parents. So meaning they after they read the receipt, all these procedures are well established, okay? And the risk is low, okay? Weightage, risk and the potential risk, benefit and the risk, okay? It's not really having high risk, so they will agree, okay? To let them let their children to join the research study. Okay, so any question on the assignment? Clear, right? Okay, so try to look for your coursemate, okay? Prepare a group and then start prepare, okay, on the consent form. So you need 2 information. One is the participants information sheet, where it includes all this information, okay? These 2 slide information, but of course not only, okay, not only these 2. And then the next one, you need the consent form, okay, the consent statement and the form, just 1 page, the one, okay. So next one, before we go to quiz, I want to touch a bit, okay. So as I mentioned earlier, you all can refer to the International Ethical Guideline, okay, on guideline number 17. So the topic is research involves children. So we have several situation criteria, okay, to pay attention, okay, to get your attention if you want to perform some research study involve some children or baby. The first one, you need to get a parents, okay. We all do not need to get both parents for consent, okay. We just need a parent or a legal representative, usually must get the consent. So not only the parent, so we need also the children. Children, of course, they are not legally can give the consent, right? But we need to concern on their assent, whether they are willing, okay, willing. So for example, although babies cannot express, okay, their consent legally, okay. So, but when they're exposed to certain treatments or certain therapy, they keep having like some reluctant or keep crying, make noise, and then do all the thing to escape. So all this clue from the baby is showing some dissent, right? Disagreement, okay, not willingness. So we cannot ignore, okay, usually we cannot ignore. So we have to agree, okay, to their dissents also, because we cannot strongly force them, right? If they are having like like some serious cry or serious like noise, and then we cannot force them to perform some procedure. So for research participants, is considered the best option, so children cannot refuse if the parents or guardian consents. So the exceptional case is if that procedure is the best option for the children. Okay, like last time we already had one example. The children need to perform some bone marrow transplant. So the children may have risk of lost his life if not perform this surgery. So meaning that this surgery is very important, okay, has benefit to the children. So in this situation, excuse me, so if the children descend, parents has the right to continue the surgery. Because in this situation, the children will not be able to interpret what is the risk and benefit, okay, balance for that surgery. But if in the case that the procedure has no direct benefit to the children, they just participate, okay, to contribute knowledge, to contribute results. So we have to pay attention to their willingness, okay. So make sure that they also give assent. So the legal age for the adolescent to give assent, consent is I think 18 years old, right? So if we are getting some research study involve adolescent from 14 years old, let's say 14, 15, 16, where they already can understand, okay, they can give the agreement, but in that case they only can serve to give the assent, okay, because they are not legally accepted to give the consent. So as long as they are less than 18, so then you need the consent from their parents, okay, one of their parents, and then they can assent, okay, they can assent the procedure. So we have some situation here. Should you proceed your research if A, okay, children assent to participate, but father consent, mother disagree. So in this situation, can you proceed? If there is no immediate benefit to the children. Can yes or no? Yes, proceed. Not proceed. No response, not proceed. You can proceed in this case because as I mentioned, you need only one parent to consent. You do not need to get both. Okay? So either one parent can give the consent. So next one, children assent, father consent, mother was not informed. Okay, same, you can proceed. Okay, as long as one parent give the sign on the consent form and children is willing to join. So the last one, children descends to participate, parents agree. Both parents agree. No, okay, in this case no, because this one has no direct benefit to the children. So we cannot strongly force the children to do if they already can express their dissent. Okay, even though both the parents agree. Okay? So in this, we have next question. So this kind of question usually will come out in the exam. Okay? So where we require some short answer from you. Okay? So we need to address some point like what's wrong in this study, what are the right, okay, for the children and what are the right for the parents. Okay? This is just one example. So for example, we have researcher A is doing some intervention study on children B, and then in some way, okay, the child B already recruited in the study. Okay, in the case in the middle of the research, child B inform the doctor or express the wish to discontinue the research. The child B, she doesn't want to continue anymore. She wants to withdraw from the study. So the parents insist that the child B should continue because he already in the halfway of the experiment, and it can actually generate a lot of information, benefits, knowledge to a larger population. Oh, how good their parents. Okay, think for the community. Okay, so the researcher A proceed because because listen to both their parents. Both the parents agree, right? So the researcher A proceed the research. So what is wrong in this statement? What is wrong? So if you're having this kind of question in the exam, you can we don't limit you to write, okay? And please don't limit yourself to write, okay? You can give in point form like one sentence followed by another sentence, okay? To address all the what do you think? Because sometimes one or two sentences you written in the exam may not strongly justifies for the marks, okay? So maybe next sentence is included some keywords or important point, okay, for the marks distribution, okay. So make sure you include any point you can think of, include in the result. So in this situation, what is wrong? What is wrong? So the researcher A should not proceed the research, right? Because the researcher A should agree, okay, should concern on the dissent, should respect, okay, respect the decisions of the children because the children already disagree to continue. The child B has the right, okay, has the right to withdraw, okay, from the study during any stage of the research study. Okay, in the case if researcher A will question why you want to withdraw from my study, why you don't want to continue, is that right? No, right? Why it is not wrong? So you have to justify why it is wrong or why it is right. Can you get me? You cannot just say this is wrong. So you need to tell me why it is wrong. Because all the participants has their privacy right. You remember we have learned different types of privacy. We have one is decisional privacy, meaning that if the participants has decided to withdraw, so we cannot force him to give you a valid reason why you want to withdraw or why you want to quit from this research study. Okay, if you keep forcing them to give you a reason, meaning that you already violates the decisional privacy. Okay, so you have to relate, okay, from what you have learned during the lecture. So this one we have to respect to the children and we need to get the assent from the children. So if the child B already decided to not to withdraw, we have to respect to their decision and let them know, okay, their continual treatment will not be affected. Even though you withdraw, you just say, okay, if you decided to withdraw, your continual treatment or your continual therapy, your medical service will not be affected. So all this information you need to give to the child B. Okay? So last one. So we have some exceptional case where we do not need the consent from the parents. So what are the exceptional cases that we do not need the consent from the parents? So for example, if you are conducting a research about the child abuse, so do you think that all the parents will give you the consent in this study? No, right? So because they don't want you to find out more about what they have done on their children, right? So in this situation, so if you want to do this research, you do not need to obtain the consent from the parents. So what are the other examples that can use this exceptional? Only child abuse? What are other examples? If you want to do some research study involve some sexual disease, okay, sexual transmitted disease, okay, where certain child or adolescent do not wanted to let their parents know, okay, about the situation. Okay, we cannot let the parents to know. Okay, because if they let their parents to know, the child or adolescent will be subjected to certain risk, right? The parents will maybe give some punishment or ask them to may harm them, okay, before participates in the research study. So if you have some research study like misusage of drug, okay, or pregnancy, abortion, sexually transmitted disease, or some cosmetic violation, okay, or violence activity, so you can actually apply to the ethics committee to waive, okay, do not need to obtain the consent from the parents, only for several exceptional cases. Okay, so that's all the topic covering the research involve the children, and please refer to the guideline, okay, for more details so that you can apply all the information in your consent form. Okay, so before we go to quiz, any question? No, right? Clear, right? Should be. So make sure you all distribute the work between your members, and then you can finish, okay, your assignment 2. So assignment 2 will be our last assignment. We have no more assignment, only these 2, and then last one we will have our exam. Okay. Next one, we have a few questions for you all to join.